Lawmakers have begun discussions on the government's new budget proposal, and his health care proposal is a top priority. Today, the governor traveled to the Central Valley to promote a controversial part of his spending plan. The governor wants to remove immigration status restrictions to Medi-Cal. Under the governor's budget proposal, the state would then spend $2.2 billion to extend health care coverage to everyone, regardless of immigration status, starting in 2024. The governor says his plan makes financial sense.
Those of you that don't believe in the principle, why do you maintain a system that's costly and inefficient, that does not lower costs for everyone and does not provide the outcomes to keep our communities healthier and safer? I'm not interested in inefficiencies. I'm not interested in the status quo. I think we can do more and better and lower costs for everybody. That's what this proposal represents.
If approved, the governor's health care proposal would be a first in the nation, but it does have its critics. KCRA 3's Maricela de la Cruz talks to people who would benefit the most from the proposed plan.
Governor Gavin Newsom's plan to expand Medi-Cal to everyone in California, regardless of their immigration status, would be a first in the nation.
Wow, sería un gran beneficio.
A great benefit for Californians who aren't insured, like these farm workers. Newsom's plan includes the creation of the Office of Healthcare Affordability. This would be beneficial to those who are still unable to pay for healthcare costs.
Access to healthcare, allows them to live, productive and healthy lives, and especially access to primary care, so that we can catch diseases before they turn into something worse or people end up dying.
One Community Health in Midtown Sacramento already offers low-cost services to the uninsured and to undocumented immigrants. They say health is a human right. And that's exactly in par with UC Davis student-run clinic Clinica Tepati, which has been running for almost 5 decades.
That a lot of these patients wouldn't be gaining any of these special needs if they didn't have Clinica Tepati as an option. So the fact that it's gone on for so long just shows the value of it. I think it's very important to note that since 1974 is a long time for a clinic to be running via students.
Jose Luis Cortez Perez says that the law would bring his family peace of mind. Currently, preventative visits are not an option for some of these workers.
Yo tengo algunos problemas.
Jesus Garcia Castro says he's avoided the doctor despite needing assistance because he's afraid of those costs. And for Jose Luis, medicine is too expensive under his salary. But not everyone agrees with the proposal.
It provides false hope. I don't think that this is a real proposal. And I think what it does, it gives them a hope that there's a remedy for their challenge that's not real.
Assemblymember Tom Lackey says it's going to be costly for taxpayers. In the meantime, community clinics say they're going to keep serving the underserved.
This is an actual problem where if we don't have services like these patients have no help.
Currently, there's an estimated 764,000 undocumented immigrants in the state of California, and if this proposal is approved, it would go into effect in 2024. In Sacramento County, Maricela de la Cruz, KCRA 3 News.
Lawmakers have until June 15th to pass a budget with possible revisions.